It's genuine interest in what's important to the patient and what barriers is the patient experiencing in terms of their health, and how might you put that patient at the center for themselves and the center of society to have a healthier, better experience for everyone.
I'm here today with Randall Rutta, the CEO of the National Health Council, and Audrey Duval, the Executive Vice President, Head of Corporate Affairs for Sanofi. How are you?
Very well, thank you.
Randy, talk to me a little bit about the National Health Council and what you do for patients in the U.S.
Sure, happy to. The National Health Council has been in place more than 100 years to make sure that the voice of the patients themselves are just part of the conversation so they can better understand their health and better lead a healthy and productive life. So the National Health Council brings all the perspectives forward, patient groups, industry groups, including Sanofi, all the partners, clinicians, nurses, academics, and researchers together around that patient voice to say it's never too early to engage the patients, to understand what's important to patients, and to advance that through our policy work and through our programs in education.
Thank you for sharing. Audrey, what is your role at Sanofi?
This is a big role, but it's all about what we can do for the patients. So in a nutshell, this is about public affairs, this is about communication, this is about sustainability projects. So many things that we do, but what we do have in common in this team is the patient to move the barriers, to ensure that we can bring our innovative medicines and vaccines quickly to the patient.
A very important role. Thank you for being with us. So both of you, let's talk a little bit about your priorities that you have. Audrey mentioned about the patient. Randy, you talk about the patient.
Absolutely.
So let's talk a little bit about that. What are your key priorities as you're looking the next couple of years?
Well, the key priorities for us is just understanding what are the barriers to patients in leading their lives in a healthy way, and how can we bring solutions forward, treatments forward, create an environment around those patients to really access those medicines, those vaccines, those treatments that help them understand their health and lead a healthy life. That's really our number one priority.
A very important and very clear priority. Well, at Sanofi, you are in charge, Audrey, of one of the key programs called Integrated Patient Engagement. A little bit of departure from just patient centricity. It's much more action-oriented. Can you tell us a little bit about what is Integrated Patient Engagement at Sanofi?
Thanks for this great question, because for us this is all about broader and faster access. Yeah. And to succeed, of course, we need to work with the patients. Patients are everywhere, in our activities, from R&D, to patient groups. But having great discussion is not enough anymore. So for us, it's how we move into action mode. And integrated patient engagement is a movement. It is a real movement. And for us, it's to be committed and to succeed together.
Very important. And it's around the world, am I right?
Exactly. It's a global program because, of course, we can make some great progress in the US, but for us, we can learn from the US. But after that, we can develop, have nice programs in every country where we serve at Sanofi.
But it's so important. So integrated patient engagement is from how we develop medicine to make sure that the voice of the patient is included, to how patients have access to this medicine and vaccine. And we integrate the voice of the patient. In Sanofi, we're not only listening, but we're also acting and sometimes leading. I think it's very important.
Absolutely.
Now, Randy, in your role as a CEO of the National Health Council, I know that you are working with a lot of stakeholders, that they are other pharmaceutical company, payers, governments, regulator, to talk about the importance of integrating the voice of the patient. Right. And you want the whole healthcare system to have the patient as a true north of everything that we do. When we ask you, and you generously offer to help guide Sanofi in the development of this integrated patient engagement worldwide, how was your experience?
I've had a great experience collaborating with your colleagues at Sanofi, the two of you, because it's so sincere. I understand that patient centricity, and actually more than that, integrating patients in every decision that's being made at the earliest possible time is part of the values of your company. And I see it as part of the values of the people that are working at Sanofi. And so I've seen that come through when I've been invited in to try to provide advice, to try to bring groups together. It's genuine interest in what's important to the patient and what barriers is the patient experiencing in terms of their health, and how might you as an innovation company, as an influencer around the world, put that patient at the center for themselves and the center of society to have a healthier, better experience for everyone. And you know, when you're talking to any decision maker, anyone who has a role to play in healthcare, at the beginning and end of the day, they themselves, their family, their community has a patient experience somewhere in that. If we can call their attention to that and then build from there, it works.
Well, we appreciate all the hard work and the guidance that you provided us. And I think one of the most powerful things that I've heard from you, Randy, over the years is the importance of pharmaceutical company or any other stakeholder to not do things for patient, but to do things with patient.
Exactly.
And I think it's a very powerful end to our discussion. So thank you very much for being here today.
Thank you.
Thank you, Eric.
Thank you.
Thank you so much.